Mosquitoes are actually the #1 killer of humans in terms of animals, causing death in humans. And we know that that a lot of different infections can be transmitted through different kinds of mosquitoes, including malaria, West Nile virus, a lot of different infections that cause infection in the brain, dengue fever, chikungunya virus, and then Zika virus is the more recent one that is making news because of some of the infections that are caused through mosquitoes. There are many things that public health in general is doing to reduce the amount of infections related to mosquito-borne illnesses, and that generally is through mosquito control. But there are things that individuals can do to protect themselves. If you're going to a mosquito endemic area, especially those areas that might have malaria or dengue fever or perhaps even Zika virus, putting on insect repellent several times a day, and usually we recommend having 25% DEET. DEET is the active ingredient. If you're really going to be sort of deep in the woods and really unavoidable mosquito exposure, you can do more things, making sure you're completely covered up, perhaps even having permethrin, which is an insecticide, coating your clothing. And if you're really going to be sleeping in areas with a lot of mosquitoes, especially places that are endemic for some of these mosquito-borne illnesses, think about sleeping within a net. When we have an infection that people sometimes don't even feel anything from, but it can result in birth defects, this is where we really start to get worried about this infection. We saw this previously with rubella. Of course, we have a very effective vaccine against rubella. Unfortunately, because of the reduction in the uptake of MMR vaccine for what seems to be unscientific reasons, we may also start to see resurgence of rubella infection. But in this case, with Zika virus infections, you do have to be exposed to the vector. And so things that can prevent infection through mosquitoes can help to prevent this.